Hi, I'm Hope Miller. I'm the Global Health Chief Resident at the University of Minnesota. Listen closely to the following interaction between a patient, his brother, and a physician during a clinic medical screening. Think about what is good and bad in the scenario.
ማታ ደግሞ ትናንትና ብዙ ጠጣችሁ እንዴ?
አይደለም እሱ አይደለም እባክህ ታመኛል በጣም ቁርጠት።
እስቲ እንግዲህ ዶክተሩ ይመጣል የሚለውን እንሰማለን። እኔ ግን ምናልባት መጠጡ አብዝታ ሊሆን ይችላል።
ኧረ መጠጥ አይደለም እባክህ
Hey, how's it going? Just here to check see how you're going today, and then let's get some paperwork filled out and get you out of here, okay?
He doesn't speak English. I'll interpret for him.
Oh, you sure? I mean, I guess I could call our interpreter, but since you're here and you know him, maybe we should just go with that.
Yeah, I interpret for him all the time, so it's fine.
Sounds great. Good morning. How are you? I'm just going to ask your brother some questions about how you're doing. So can you ask your brother how he's doing today?
Yeah, he's fine.
Does he have any problems at all? Like, why is he here today? It's like maybe he has a little gas or something.
Yeah, it's some little gas.
Maybe a little gas. Okay. Does he have any past medical history, any medical problems at all?
one day ትዝ ይለኛል በልጅነቴ ሆስፒታል ገብቼ ነበር ከእናታችን ጋር ሄደን አንተ ትዝ አይልም ሆስፒታል ላይ ገብቼ ሰው መጥቶ እየጠየቀኝ ጎረቤት ምናምን ትዝ አይልም
መቼ ነው እሱ
ልጅ ሆኜ 15 ዓመት ምናምን አካባቢ በጣም ታምሜ ነበር ትምህርት ቤት ለቀርቼ ምናምን አታስታውስም በጣም ለረጅም ጊዜ
ድሮ ነው እሱ ታዲያ
ያ ቢሆንስ እሱ የሆነ ከሱ ጋር የሚያገናኘው ነገር ሊኖር ይችላል ንገረው
Yeah,
No past medical history?
It's fine. No.
All right, good. Can you ask him if he's ever had TB, you know, like a pneumonia for a long time, coughing, weight loss, night sweats, hemoptysis, lymphadenopathy, anorexia?
HIV is No.
Has he ever lived with anyone that had TB?
We live together, no TB.
Oh, good. How about syphilis? Can you ask him if he knows about syphilis or if he's ever had it? You know, some of these people just go out there having sex with everyone. I think they just weren't raised right and they get all sorts of diseases. So just ask him about syphilis.
Yeah, he only sleeps with his wife.
Oh, okay, all right. You know, he really doesn't look that hot. Does he have any constipation, diarrhea, hematochezia, hematemesis, mid-epigastric pain, anorexia? Has he eaten something funny or not been washing his hands?
Oh, ስትበላ እጅን ትታጠባለህ ወይ ነው የሚለው
ትታጠባለህ እንጂ ጠዋትም ማታም ቀንም ትታጠባለህ
What's he saying? What's he saying here?
He washes his hands, yeah.
All right. So basically, he's not that sick and he's got some gas?
Yeah, it's some gas.
Okay, good. Let me just check a couple last things. Oh man, his blood pressure is really high. I'm gonna go tell the nurses they should recheck it. It can't be that high. He probably just was nervous. Wait here, I'll be right back.
በቃ ለዚህ ቁርጠት ነገር መድኃኒት ሰጣለው ችግር የለውም ሁሉ ሰላም ነው እያለ ነው
ሁሉ ሰላም ነው እንደዚህ ታሚ ሁሉ ሰላም
አዎ ሰላም መድኃኒት ይሰጣል ያመጣላል አይዞሽ ሰላም ነው
Now think about the following questions. Do you think the patient's brother was an effective interpreter? Why do you think he was chosen to speak for his brother? Did the physician have a choice to work with a trained medical interpreter? What would you have done in that scenario? What were the family member's limitations when interpreting for his brother? Are you suspicious that the patient's responses were not correctly or not completely interpreted to the physician? Did the family member censor the patient's responses or add commentary when information was conveyed to the physician? Do you have confidence in the medical history that the physician obtained? Please pause now to discuss further. Was there anything in the nature of the physician's speech pattern or chosen medical terminology that might have been difficult to interpret? Did it slow or confuse the encounter that the physician did not use the first person when speaking through the family member? Do you think that the physician added commentary or was more judgmental than he would have been had he spoken directly with the patient? Did the physician check to be sure that his patient understood the interaction? What could be the implications of an inappropriate history for this patient? Could this interaction have been improved in your setting? What would you have changed? Please pause now to discuss further. Next, you will view two scenarios. The first depicts a doctor who speaks some Spanish and tries to get by without asking for an interpreter. Watch the consequences of her decision not to call an interpreter.
Hi, how are you?
Gracias, estoy bien, pero está mal mi hijo.
Doctor, do you want me to get an interpreter?
No, I think I'm okay. I think my Spanish is fine.
Okay.
Bueno, señora, ¿cómo la pasó esto?
Se pegó cuando se cayó.
Oh, you know what, nurse? I think we should call the social worker and child protection. It sounded like she said that somebody hit the child and then he fell down.
Okay, doctor.
The second scenario involves a family member receiving news about a loved one. What are the consequences of the person chosen to interpret for this scenario?
Hello, are you Abdi's sister? I'm one of the doctors who's taking care of Abdi, and I just wanted to talk to you a little bit about some things we've been doing. And the good news is that we've done some lab tests and we've gotten some results.
No English.
Oh, you don't understand? Oh, I'm sorry. I'm sorry. Let me see if we can find somebody who can help us. Mohammed, can you help us here?
Sure, doctor. I would be happy to.
This is Abdi's sister, and I wanted to tell her about Abdi's condition. He has some very bad infections, and we're trying to figure out what's caused these infections and made him so sick. We've done some lab tests for HIV and hepatitis, and those lab tests have come back negative.
Dhakhtarku wuxuu yiri waa halkaa AIDS ma qabo waa arrin fiican sababtoo ah waa cudur xun oo ku dhaca dadka khaniiska ah.
It is often difficult to find a trained medical interpreter. Have you seen people trying to communicate with patients in broken language or false fluency, or asking untrained community members to step in and help communicate between languages? Did you note that the lack of knowledge of vocabulary, correct syntax, and verb tense seriously changed the core meaning of the conversation? Are the concepts of confidentiality, medical ethics, and basic medical knowledge commonly understood by all bilingual people who may be asked to temporarily fill in the role of an interpreter? Have you struggled with confusion and slow, inaccurate communication due to lack of access to a trained medical interpreter? Have you ever worked with a trained medical interpreter and felt relieved to be confident that you have a good understanding with your patient? Please pause now to discuss further.